Hey there, everybody, and welcome into the webinar. I'm Dr. Jeff Grosskopf, and we're going to be talking about chronic pain today, and specifically what I treat here in my office: chronic low back pain, neck pain, chronic headaches. And this is going to be very eye-opening for you. I've been doing this for a long time. I'm going to show you exactly why you're suffering these pains. I'm going to show you what is the number one cause of chronic pain, and then how it can be taken care of. And we're going to show you what other doctors simply miss. Because if they're not an expert, if they don't know what to look for, I always say doctors look for what they know to look for. So I'm going to show you what the cause is. We're going to get into that. I'm going to show you how we treat it. And anybody you know dealing with chronic pain, they're going to have these injuries that I'm about to show you here. So a little bit about myself at the time of recording this. This is me and my family, my wife Amy. We live out in Sussex. I grew up here in Wauwatosa, went to Tosa East. Took off for about 10 years doing all my schooling, getting my doctorate. I came back, opened my practice here 17 years ago. And at this point, I've treated thousands of patients. And, the reason I got into understanding this chronic pain problem is because I started treating a lot of patients who had been in car accidents. And these patients who had been in car accidents were having long-term chronic pain, even though after the car accident they got treated by a therapist, maybe a chiropractor, an orthopedic, and they felt better, but then years later they kept getting worse. And that led me down this rabbit hole through my career of really figuring out what was going on with these car accident victims. But then that spilled over into understanding why the average person who's suffering with chronic neck pain, headaches, low back pain, the specific injuries that they have to their spine that they don't know that they have, that aren't being worked up properly by their doctor. This chart here, if you just take a peek at this gives you an idea of how people suffer with chronic pain. They'll have pain, they'll go to a doctor, maybe it's from a car accident, maybe it's just they're experiencing pain. They get better, but then over time, they get through their treatments, but then over time, things start getting worse. And it's because they're not being properly diagnosed, they're not being properly treated, and they're not getting the proper stabilization care that they need to be living pain-free. And as I mentioned, chronic pain is a huge problem. Right now, there's likely someone just within your household that suffers chronic low back pain. If not you, your neighbor has somebody who does. 25% of households right now have somebody who suffer with chronic headaches. Anywhere from 30 to 50% of people or households have people with chronic neck pain. So just imagine wherever you live, if we went down your streets, we're going to find a lot of people suffering with chronic pain. It gets worse as we get older and our bodies degenerate, and I'll explain why. But it's a big issue. And I'm going to explain why that is. The people who are having chronic pain, the problem is they have an injury to the ligaments of their spine. It's just never been worked up. It's never been properly diagnosed. So I'm going to show you what these injuries that you have to your spine, what they are, how we find them, and how we treat them. It's very simple. So first we need to talk about what your spine is and what it's not. Your spine is two things. It's the bones and it's ligaments. So ligaments are connective tissue. The ligaments hold the spine together. And you also have the disc ligaments. So if you look at this chart here, the disc ligaments are in the blue. The red support ligaments, there's far more of those. Now, your spine is not your spinal cord. If you had a spinal cord injury, you're not going to be on this webinar. You're going to be in a wheelchair. We're not going to talk about spinal cord injuries. We're not going to talk about nerve injuries. Now, you may have a nerve that's being irritated because your spine's injured, but I could take a knife and cut a nerve and not injure your spine. So the nerves are not the spine and the muscles are not the spine. We could injure or cut the muscles of in your back, but not injure your spine. So your spine, I want you to remember this. It's very simple. Your spine is bones and the ligaments, the red support ligaments and the blue disc ligaments. Now, once we know what your spine is, we know there's only 3 ways that you can injure your spine. Okay, you can fracture it, you can break a bone, and we're not going to talk about that on this, if that's very easy to find and diagnose. You can have a disc injury, a bulging disc, a herniated disc. Many of you listening or watching have likely been diagnosed with that, but I'm going to show you how that doesn't explain the majority of the chronic pain problems that you have. Lots of people, some doctors and research estimate 50 to 70% of people are walking around with a disc injury, meaning a bulging disc, and they don't have any pain. So it's very possible to have a bulging disc and not have pain. The last injury that you can suffer is an injury to the ligaments, the support ligaments of your spine. And when these get injured, they're very severe and they cause chronic pain. So that's what we're going to talk about. There's over 220 different spinal ligaments. 23 are the blue discs here. The rest, that's only 10%. The rest of your spine is all this red. If you take a look at these pictures we have here, you've got the bone, the disc, and then all the red support ligaments. And when those red support ligaments have been injured, they're going to cause chronic pain. All those red ligaments are very pain sensitive. The main job of your discs are to absorb, they're a shock absorber for the most part. But the red ligaments are for support. They're pressure sensitive. They're very pain sensitive. And when we look at the research that's been published of what type of symptoms you can have with these injuries, if you look at the discs, you can have axial pain, which is pain on the spine, and you can have radicular pain, which is pain going down the arms or down the legs. Now with the red ligament injuries, you can have a lot of problems. You can have headaches, dizziness, tinnitus, insomnia, vertigo. You can get the other issues of pain down the arms, down the legs as well. So it's very important that we differentiate the symptoms that you're having so we know if you're more likely to have a disc or a red ligament problem. It's more likely, I know I've been doing this long enough, if you're suffering with these symptoms that are chronic, you have an injury to your ligaments. It just hasn't been worked up properly by a doctor who focuses on this. I want to talk about the very upper part of your neck, the upper cervical spine. That part of your spine, the top two bones, there's no disc up there. And so a disc can't explain the problems of people with chronic neck, back pain, headaches, dizziness. In fact, an injury to the ligaments of the top of your neck are going to mimic the injuries that people get with a concussion, such as dizziness, insomnia, vertigo, ringing in the ears, headaches, migraines, unsteadiness, trouble breathing, anxiety. These are all caused or can be caused by the upper cervical spine. Now, if you've had a traumatic event like a car accident, we do want to differentiate from a concussion to see if that's part of the clinical picture as well. So we're not downplaying that, but we're just pointing out here that the injury to the upper part of the neck and those ligaments can be the same crossover symptoms that you're going to have with a concussion, and these symptoms then become chronic. So when we're looking at those red ligament injuries, those support ligaments, how do we know if they're injured? Well, it's actually very easy. We're going to do a specialized series of x-rays, and these x-rays are done by putting your head and neck in different positions so that we can see how much movement there is between the bones. And if there's excessive motion, then we know the ligaments are injured. It's very simple. We know it's unstable. That's how these tests are done. We can't do this with an MRI. It has to be done with a series of x-rays and a specialized series of x-rays that can then be measured. So when we talk about measuring this, as we're looking at, let's go back real quick. We can't go back, so we're just going to stay here. When we're looking at those x-rays and we're seeing how much movement there is between bones, there's very simple guidelines that we already have in the medical literature that we know what's normal and what's abnormal. And so when we're looking at how the bones move on top of each other, if there's more than a millimeter of motion, we know you have a ligament injury. We know when we look at how the bones tip and move this way, that's called angulation. There's a certain amount that's normal, and then there's a certain amount that indicates that you have damage to the ligaments, and now they're loose and the bones are moving too much in those segments, or those, when I say segments, it's those areas of the spine between those two bones. Again, this can all be measured. Specifically when we have car accident cases, and these are things that could go to trial or go to deposition, we measure these out. Typically 30% of the people who come to see me and we evaluate for these injuries, for these ligament injuries, 30% are at a cervical level, a surgical level. So that means they're so bad that the person could qualify for a spinal fusion surgery. Now, do I send all my patients out for surgery? No, we don't want you to have spinal surgery. We're going to treat you and help get these injuries stable. But the point here is that it's so bad that you can qualify for a surgery. It doesn't mean you need surgery. We almost never recommend spinal surgery for these cases because we're going to help you and we're going to get you better. I'm going to show you in a second how we treat you. But that gives you an idea of how bad. 30% of them are that bad that I see. Again, people don't know until you do the test and measure it. I'm going to play you a video here. And we're going to turn off the volume. I'm going to describe this as we go through. This is going to be a video that's going to show you what these injuries look like. So you're looking at here a picture of two bones, and everything holding the bones together are the ligaments. So we're going to activate the animation here. It's going to start moving the bones, and you're going to see that red pop in. That's where the ligaments are getting injured. Okay, when you have falls and car accidents, you strain those ligaments. They go beyond their normal range of motion, then they swell. They're very pain sensitive. When they swell, what you're looking at here is a nerve in the spine. Once a nerve gets irritated, that's what can cause neurological issues like migraines, like dizziness, like vertigo. Here's just another angle of the injuries where a bone's sliding or moving too far. Now, once you have these injuries, that injury is there. So if this happened when you're 15 and you're 30 years old now, that injury is still there. You're living with it. Those ligaments don't rebound and go back. So that's a permanent instability that you now have in your spine. And that's why it's so important that we do the proper testing and we measure it and we get you the right treatment, because this can all be treated. We can help you and get you out of pain and get you feeling so much better. Here's another image. This is the top of your neck. These are the ones that I see on patients who are suffering with chronic headaches or migraines. These are the most common injuries, the very top of the neck where those ligaments have been injured. All right, so we're going to stop that and go to our next slide. So how do these injuries occur? Well, car accidents is a big one. Anybody who's in a car accident, I would say 80% of the people with a significant car accident. And a lot of times when you're in a car accident, you don't feel the pain initially. It takes 48 to 72 hours for everything to swell up and start to hurt. But most people in a car accident are going to damage the ligaments. I would say in my experience taking care of car accident victims, 80% have ligament damage. However, it's almost never found or documented if they don't get to the right doctor. And don't assume your doctor looks for this. Most of them are not looking for it. And you can ask them, Doc, did you work me up for a spinal injury? Did you work me up for a ligament injury? If they say yes, say, great, show me my x-rays. It's a very specific set of x-rays that need to be done. How else do they happen? I see a lot of men who in high school and college they played football. They experience injuries. A lot of men when they're younger and doing their contact sports, they get injured. They get hurt. They start feeling better, they move on. But then these injuries, as you get older, it accelerates the degenerative processes in your spine, and then you start feeling them. That's why as we get older, we have more aches and pains. We degenerate quicker. And if you have injuries to your ligaments, your degeneration is a lot worse. Okay. And then, lastly, people have slips and falls. And you may have felt fine or think you got pretty hurt in a fall. You slipped on the ice. You fell off the swing set as a kid. You were hurt. You had neck pain, back pain. Maybe it was pretty bad. But the swelling goes down. You feel better. And then later on in life, you start having some chronic pain. That's how this all happens. Here's some quick stats I can give you. Now, these are for car accident patients, but this is to show you how chronic the problems are. There are multiple studies. I have lots of these particular slides that look like this that will show you the significance of the long-term chronic pain people experience. So this was a 2-year study, and you can see it was 48 to 62% of the people within the 1 to 2 year process had chronic neck pain after an injury in a car. Here's a study that found 43% after 5 years. This is a study, this one saw 100% after 2 years. This was a long-term one, 10 to 19 years, 86% of the people had chronic pain. These were people who were in car accidents. And it just goes to show you as we do the research, it's very, very high numbers. It depends on the group of people that the study takes and what they're looking at and the type of injury. But people who have chronic pain, it's chronic. It's not going away. And drugs and constant therapy is not helping people. It's not going to fix the problem. Now, let's talk about if you have degenerative disc, arthritis, a bulging disc. If you have these conditions, so if you look at the spine here, if you have degenerative disc, if you have arthritis, you also have a ligament problem that's just not being diagnosed. And because, again, the ligaments are supporting the spine, they play a support process in the discs themselves, that if you have a ligament injury and then you have a disc that gets bulged or that begins to degenerate, you also have a ligament injury. And so your degenerative processes are going to be much faster and much worse. A red ligament injury makes the disc problem way worse, and you need to get the right diagnosis and treatment for this. Research tells us the ligament component, again, I could go through slides and research and show you how the ligament problem causes a lot of problems for people, and it needs to be getting more attention. So that's what we focus on 100% in my office. Now, beyond the chronic neck pain, back pain, headaches, what do I see? I see a lot of people who also have shoulder pain because the nerves come out of the spine into the shoulder. Shoulder problems are very common that I see associated with the spinal injuries. I take care of a lot of pregnant women. So many women, they have maybe mild low back pain. They get pregnant, and the pregnancy is going to basically put a ton of stress on those injured ligaments that they don't know are there. So it's so important, pregnant women, get chiropractic care for one. It'll change your life having chiropractic care through a pregnancy. Ask any woman who's had a regular pregnancy and one with chiropractic care, and it's night and day. So that's something also we take care of a lot of in our office. Now, you're going to see this little icon here. It says Spinal Kinetics. That's who I use if I have a car accident patient. We send out these x-rays to get measured so we know precisely what's going on. We know exactly the degree of these injuries, but the point is radiologists can't measure these. You need a very specific type of software that's all third party, so we have to send them out. I can see these when I look at x-rays because I'm trained in it and I know what to look for that the average doctor is not going to look for. But if I want to precisely measure it, we send it out. So you're not going to get this in the emergency room, a hospital. If you've been in a car accident, for example, you go into urgent care, they're not going to do any of this. Their main goal in urgent care or in in ER is just to make sure at that moment that you're not going to die. There's no life-threatening injuries. That's their primary goal there. So don't assume because you went to the urgent care, they said you're okay, or you had a follow-up with orthopedic, and they said, oh, you'll be okay. That's not the case. If you're not looking for the injury, then you're not going to find it, and time is not on your side. So when we do measure these out, we're able to see exactly where these injuries are. We can tell to what level it's damaged. We already have the guidelines. This is the consensus guidelines, meaning within the medical field and in the chiropractic field. We have the guidelines, meaning if you have these injuries, we can measure them, and there's very specific treatment protocols for this. It's easy to fix if you know what you're doing, if you know what you're looking for. All right, and then lastly here, when we have measurements, we have the AMA guidelines. So the AMA, that's the American Medical Association, these are the guidelines to how severe these injuries are. So earlier I was giving you some numbers of how much movement in millimeters. That's where these guidelines come from. And we use these with car accident victims, or maybe a lot of my patients that we look, they have a disability impairment, meaning they have maybe a 25% disability rating, and sometimes it depends on the state, but these injuries qualify a person for disability payments. So that gives you an idea of the significance of these injuries. If you've been in a car accident and you've had these injuries and it's measurable at certain levels, it makes a huge difference in your settlement process, and people get very large settlements for these injuries because they're that bad. So how do we treat ligament injuries? First, we stabilize them through chiropractic care, which I'm going to show you. I'm going to play a video so you can watch me taking care of somebody. We get you moving regularly. We give you exercises to strengthen the spine after we've treated and got stable. And then we talk about controlling inflammation. So I'm going to play this video. This is me adjusting a patient. You're going to see me just go through the process. First off, if you just look here, this little instrument that you can see there, that's a handheld device. It's FDA cleared. It's called an integrator. That's what I use to adjust the spine. You can see it's got a small tip on there, and you'll see me adjust this patient in a second. But it allows me to very precisely adjust your spine. So with this video, you see me touching his feet. I'm just going through a protocol here where I'm going to find exactly what we're doing. This patient, he came in with chronic neck pain. He had already had a back surgery, and he knew that that's not the way he wants to go in the future. He's in his, I think he had just turned 50 right around the time of this video. Active guy, active, fit, taking care of himself, but he's got chronic pain. And he's been through, other processes with pain medications. He's had surgery. You're going to see me just take this device. Hopefully I don't know if this particular one is going to hone in on it. Let me see here. What I do is I take that device, I just place it on the bone. It gives a nice gentle adjustment here, and that's how we adjust your spine. So we don't ever twist. We're not twisting. We're not popping your spine. We don't do any type of that care. I don't like that. There you can see me doing some adjustments to his neck there. Very gentle, no twisting, no popping. Again, everything we do is FDA cleared, guideline approved. And people feel significantly better. I can't tell you, one of the best parts of my job is just helping people feel better, get back to living their life. So We do the chiropractic care. That's the foundation. Secondly, I need to get you moving. 60 minutes a day. Some people can't do that first, but our goal is to get you moving and walking 60 minutes a day. Next, we're going to strengthen you. Now, you don't necessarily have to go to the gym. I know all these people are lifting weights. This looks serious, but you don't have to do this. We give you exercises that you can do right at home and that you'll be doing to help stabilize the adjustments, the treatments that we do. And then we need to control inflammation, and this is through diet. So I'm also a licensed in nutrition counseling. So I help patients quite a bit with this. And so when it comes to your diet, we keep it really simple, that things everybody can do. One, avoid the foods you know you should avoid. Everybody watching this, if I said, what shouldn't you be eating? You could probably think of 3 or 5 things that you go, yeah, I should probably stop eating that. So stop eating those things. Secondly, don't eat anything that bloats you or gives you a negative response. If you're bloating, if you have indigestion, you shouldn't be eating those foods. Third, do you ever wake up with pain? Do you wake up stiff and sore? I want you, if that happens, to think, what did I eat last night or yesterday? Did I have some cake? Did I have ice cream? Did I have a bowl of pasta? If you're waking up stiff and sore and you notice it, then you're probably eating something that your body doesn't like that's causing inflammation. Fourth, no seed oil. Seed oils are terrible. If you go to a restaurant, the burgers, the fries, most food is fried up or cooked up with seed oils that are heated up. And seed oils are extremely inflammatory. There's seed oils in all your processed food, your potato chips. They're often in your breads, anything that you're frying up. And I help patients with that, to identify that and how to read those labels. But you got to get rid of the seed oils. And lastly, what you do need to do, and you can start this now, is I get my patients taking magnesium, because magnesium begins to relax the muscles of the spine. So as we're treating you and we're stabilizing your spine, and we're getting those sore muscles and muscle spasms to relax, the magnesium is fantastic. And then we want you doing omega-3 fatty acids, because these treat inflammation. You can do cod liver, you can do fish oil. Cod liver oil has vitamin A and vitamin D in it as well. And then lastly, if you're watching this and you or someone you know needs to get an evaluation, we don't charge to do consultations in our office, meaning to come in to talk and evaluate your spine to see if you have these injuries. We make it very easy for you. You can do a couple things. You can go right onto my website, spineinjurywauwatosa.com, and you can schedule an appointment right there, no charge consultation. You can call our office at the number there. Our office we've got a great location. We're on 104th and North Avenue. We're right across the street from Mayfair Mall. We have a ton of parking. We're a few blocks from the expressway. So if you're a little north, south, east, west, we're very easy to get to. You can get to our office in 10, 15 minutes, basically from anywhere in the Milwaukee, Waukesha area. Lastly, just hang on here, because this video is going to redirect you to my website so you can look more at our site, and you can schedule your appointment right there. So thank you for taking the time to watch this webinar. Follow the instructions here, or follow the redirect to my website. And if you're suffering with chronic pain, we'd love to help you out. Take care.